of vaccine recommendations for kids is being lowered from 18 vaccines to 11. Now, this comes after the CDC found the U.S. recommended more childhood vaccine doses than similar countries and more than twice as many as some European countries. Abby Wilt joining us in studio now. Abby, how are the Idaho doctors reacting?
Epidemiologist says this announcement is still fresh. They're still working through what to recommend to keep all children healthy, especially in schools here in Idaho. But one parent calls this a step toward medical freedom for Idahoans.
For Carrie Price,
we can't be like a one-size-fits-all, right, when it comes to health.
The CDC's decision to remove 6 vaccines from the recommended schedule for children came as a relief.
When I heard it, I thought, wow, so many more options for moms, so many more options for families.
On Monday, the CDC announced doses of vaccines for hepatitis, RSV, and rotavirus were no longer recommended for all kids. These are now just recommended for high-risk groups. The Department of Health and Human Services said the vaccine changes are meant to restore trust in public health.
None of the vaccines are eliminated, but they have been, if you will, demoted. Anybody who wants these vaccines can still get them.
State epidemiologist Christine Hahn says the Idaho Department of Health and Welfare is still reviewing the changes.
These are recommendations, so they're not requirements.
Hahn says as a doctor, she was happy to see the measles vaccine, the tetanus shot, polio, and chickenpox were still recommended, as those can be more dangerous and can spread fast in schools.
We do recommend, because these can be serious diseases, that parents talk with their healthcare provider about these vaccines and which ones they still recommend.
As a mom of 5, Price thinks this is a way to expand medical freedom so she can do what she thinks is right for her children.
I don't think anyone wants to be forced into doing something for their health or medically that they do not want to do. Health shouldn't be political.
Not everyone agrees with Price's perspective. I heard from several parents on social media who didn't want to go on camera. One said, "This puts me and my child at risk now." Another wrote, "Why wouldn't parents protect their kids from these diseases?"
We think a thoughtful discussion will really help parents figure out what to get for their child.
Dr. Hahn says while federal health officials are changing recommendations, it's important each parent talks to their pediatrician about what's best.
Make sure that you feel like your child is fully protected.
The American Academy of Pediatrics site has a full list of vaccine recommendations. And Hunter Morgan, that's a great resource for parents to look at if they are wondering what vaccines their kids are required to get, what vaccines are recommended, and as well as, of course, talking to your child's pediatrician.
Right. Okay. So going from 18 to 11 at this point.
18 to 11,
okay.
that's correct.
Abby, thank you.